A good evening and welcome to another episode of the Medi-Camp Health Show here at GTN TV, the home of gifts and talents. I am your host, Mumbi Mavuti. Today we are going to be talking about mental health. And sadly, 1 out of every 4 Kenyans is battling a mental health issue, of course ranging from mild to serious. Actually, you might have heard or at some point even said, I think I'm depressed. And now you wonder, has it all of a sudden become fashionable to be depressed? But no, we are having a mental health crisis in this country, and a lot of attention has not been generated into focusing on this. Luckily today we have a psychiatrist nurse with us here in studios. Welcome so much. Yeah, and thank you so much for making time for us. If you could take a moment and just introduce yourself to our viewers through that camera.
Thank you so much, Mumbi. My name is Christine Wanjiko Githinji, a psychiatric nurse working at Udaya Level 4 here at Nyeri County. Yes.
And you are well?
I am very well. Yes, keep up the smile.
Oh, thank you. Yeah, congratulations.
Thank you.
On your graduation.
Thank you.
Yeah, if you could tell us a bit about that. So I can give you your flowers.
Thank you so much, Mumbi. Today is my graduation day. It has been a journey of 1 year. I was doing my higher diploma at Mathari National Campus. The journey has not been easy, but we thank God it has come to this. So we have been able to graduate, the 48 of us. So I just want to pass the regards to my colleagues who are graduating and tell them congratulations. Yes.
Yeah, congratulations, Irinoda. And indeed, God is good for that journey that has come to conclusion in a beautiful way, that we are here hosting you during your graduation.
Thank you.
Yeah, so send in your congratulations messages for her. We need to give her her flowers just today. So yes, we're going to be talking about mental health and to be specific, mental disorders, because out there a lot of people are not even aware about them. So today let's just focus on highlighting them. So what are mental disorders?
So mental disorder is a wide range of conditions that affects the mood, the thinking, and the behavior. So when you talk about the mood, you can be very happy or sad. Thinking, how do you perceive things? How do you internalize the information that you're getting? And the behavior also. Is it a normal interpreted with people? And most of the time we tend to pick behaviors that are odd. So you can tell somebody is having an issue with the way they are behaving. So it's a wide range. So it's not a specific, but a wide range of conditions. That's why we are calling it mental disorder. Yes.
So there are quite many, and you mentioned that they have to do with people's moods, and so as we go along we're going to learn how exactly do you know that this is a condition or this is a disorder, because from time to time during the day, one moment we are happy and the next we are not.
Yes.
Yeah, so if you could highlight for us, what are some of these, what are the main mental disorders that we are dealing with here in Kenya?
Okay. The mental disorders that we are dealing with, not only here in Kenya, but globally, one of the common, we have the anxiety disorders. And for the anxiety disorder, it comprises of many other, because we have the specific, we have the phobias. We have ever had people saying that I don't like heights, I fear water. So it is under the anxiety disorder. We have the personality disorders, and the personality disorders is classified into 3. We have the odd, that carries the schizoid, schizotypal, and the paranoid. We have the dramatic personality disorders, and for the dramatic, the word dramatic, you'll definitely pick it, because we have the histrionic. Histrionics, they are these girls who like seeking attention. So the way they dress, you can tell there's something that is wrong with them. We have narcissistic. They are a bit, they're not respectful, they're aggressive. We have the antisocial. Antisocial, they are the worst, because initially the word that we were using, we were calling them the psychopath. maybe you have ever heard about that name. We have the borderline. The borderline, they are reckless, they are aggressive, they hate abandonment. And we have the last now, the cluster C, that we call, they are odd, they avoid, avoidant, they are dependent, they cannot make decision on their own. And then now, obsessive compulsive personality disorder, the perfectionist that we have within our mainstream in the society. Yes. Yeah, we have other disorders, sorry for that. We have eating disorders, we have the sleeping disorders, we have the psychotic disorders, we have delusional disorders. So there are many. We have neurocognitive disorders and the developmental disorders. So there are many. We cannot be able to exhaust every disorder that we have, but they are there. Yes. Yeah,
that's quite a huge range of the same, and we can't exhaust all of them today. So we are going to be taking you step by step. But for today, I think what is most common in our society right now is everyone saying, I'm depressed. Under which category is depression falling into?
The depression is in the mood disorder. And if we are to define depression, and we use now the right word for it, we can call it the clinical depression. The clinical depression is whereby it is under the mental disorder of the mood. And it is characterized, you can be able to pick it because these people, they have the low moods, they lack interest, less energy. Either they have the sleeping disorder, either they sleep a lot, ama kidogo, the psychomotor activity is reduced, they are not motivated. So when you say that you are depressed, and most of the time, because most of the time you'll hear people saying that they are depressed, you need to check, why are you saying that you are depressed? So for us to be able to diagnose you with depression, we need to pick like 5 symptoms from whatever I've said, and the word that we can use is a SIGI-CAP. The SIGI-CAP, just to make it very clear and very simple for everyone who is watching us today, it affects your sleep, it affects your interests, the sleep, the interests. There is the guilt part of it. You're always feeling guilty, you're not able to perform. There is the energy level. We have the concentration. It may reduce. We have the appetite. These are the people, maybe they will eat a lot or eat kidogo. And then they have the suicidality thoughts. So the suicidal ideations comes in. So I don't know why people are saying that they are depressed. Is it the issues that they are undergoing? But when you do your own self-diagnosis that you are depressed, when you come now to the experts, they're supposed to sit down and be able to follow the criteria and see whether you are suffering from the depression. Yes.
But you find that mostly, sometimes maybe you're sad, maybe you're grieving, or maybe you're going through a bad day and it's going to affect the next couple of days. So for how long should these signs persist before someone should say they are depressed? And is it even okay for someone to just sit back at home and because they're feeling sad, maybe they have that and diagnose themselves that they are depressed, or should that come from a doctor, a psychiatrist maybe?
In the depression, the clinical depression, we have the mild cases. These are the people that will have the low moods or they will lose interest, but they can be able to function. And those are the people that you will hear, I'm depressed. We have the moderate. With the moderate, it will affect your functioning. At one given time, maybe you might not be able to function the way you normally function. And for the severe cases, they are the people now, you'll find that they were working, they're no longer interested in work, they sleep a lot, they don't eat. So for us to be able to do the diagnosis of the major depression for the mood disorder, it's supposed to last for 2 weeks. So if you have been having these symptoms for more than 2 weeks, that is now we can say that that is a major depressive disorder. Yes.
Oh, and I had asked that is it okay that if I feel like I am going through this, for me to tell myself I am depressed? Because a lot of people are just sitting and saying, leo na feel niko depressed, or they just go like, I think niko depressed, but they haven't visited a clinician, a psychiatrist, or anyone dealing with mental health before they come to that. Can you self-diagnose through what you're going through?
Maybe you can diagnose yourself depending on the things that you're undergoing. For instance, a grief. You have lost a loved one. You have lost a job. Maybe even for the student, maybe you have failed your exams. There is the normal emotions that will go through. But that doesn't qualify you to say that you require treatment. For the people who require treatment, they are the people who have the symptom for more than 2 weeks. There is a condition that we call cyclothymia. You have low moods for more than 2 years. Yes, you are doing your things, but you are having a low mood for more than 2 years. So the people that you are staying with, they are the people, maybe they will tell you, you have a problem. Or they can pick something that is not right with you, and they will tell you, Mumbi, this is not you. So the people will give the report. They will pick something. Also yourself, you can tell there is something that is affecting you. So yes, we say that we are depressed, but let's make the professionals make the diagnosis for us.
Yeah, sure, yes. Sure. Yes. And once someone is diagnosed with depression, what does treatment involve?
Let me say, for the depression part of it, there is the pharmacotherapy. That is the use of the treatment, the drugs. We can also do the psychotherapy, which can be the individual. In the individual psychotherapy, there is the supportive, we'll have the educative, and reconstructive. It's something that needs to be reconstructed, maybe the behavior that is putting you into that depression. We have the family therapy. Maybe the things that are making you depressed are within your family. So we need to sit down with the family. Apart from you, we need to sit down with the family. Maybe it is a job that you're doing that is making you depressed. We need to involve your employer also. So it's a multisectoral management. We have the cognitive behavior, we call it CBT. We change the way you think, the way you perceive things. What about your behavior? If there is anything that needs to be changed, it is through the psychotherapy. And then you can get now involved in other groups. Apart from the individual, we can do the group therapy, just to let you know that you are not alone. There are other people who are suffering from this, and you can be well. Yes.
And do you think enough has been done in regards to sensitization and making people aware that depression is a disease like any other? Because back at home, when for most people, let me just say for most people, because I want to believe it is not everyone, the moment you raise that, a lot of people don't understand. And now you're saying that during treatment you might need to involve their family, but when you tell them, I think I'm depressed, they think maybe you're idle, we need to get busy and something like that. So do you think enough has been done to sensitize people that depression is actually a mental illness and it's something that should be given attention and treatment?
I'll say we are very far. Yes, the sensitization is being done now. But for mental health, it comes with the challenges. We have the cultural beliefs, we have the misconception, we have the stigma and the discrimination that comes with the mental illness. So for instance, if I tell you that I'm sick, you might say that I'm pretending. Maybe I don't want to accomplish a certain task that I have been allocated. In families, some of them, they might believe you, and especially the ones who have been, who understand the mental illness, but the rest will not. So a lot needs to be done, but I just want to say people have come to appreciate mental health after the COVID. A lot happened during that time. People became so depressed, they lost their job, there was the curfews that were happening, other people are in quarantine. So the government emphasized and did a lot of creating awareness, but we are not yet. Hatujafika. We are far.
Yeah.
And a lot needs to be done so that everyone can appreciate mental health and the mental disorders. Yes, and especially appreciate the people who are suffering, because these are the people that we are living with, these are the people that we are working with, and we need to appreciate. Yes.
Another of the common issues, mental health issues that people are struggling with is anxiety. Is anxiety supposed to be normal? Let's begin there.
I will say anxiety is a normal emotion that help you to recognize a little problem and be able to solve it. So if it is a normal emotion, for instance, before you prepare for exams, there is the anxiety that comes in. Yeah? That is very normal. And anxiety helps us to surpass our target. But now when it lasts longer than the stressful event, if for instance you are doing exams and the exams they are done and you still have the anxiety, and it becomes now chronic for more than 6 months or for about 6 months, that is not normal. Now it becomes now an anxiety disorder. So for normal anxiety, for anything that you want to do, maybe you want to visit a new place that you have never been, you don't know the reception, how it will be. So you'll develop that anxiety. But the moment now you get there, you're welcomed and everything is okay, that anxiety level is supposed to go down because already you have been able to solve that. Yes.
Oh, thank you so much for that. It's a lot that we are learning on this episode today. We are going to be back shortly. Allow us to take a short commercial break. See you after the break.
GTN TV, the home of gifts and talents, presents you with an opportunity to advertise your businesses, death and funeral announcements, wedding and dowry ceremonies, announcements for government meetings and those of other registered groups or organizations, and many more at affordable prices. For more information, you can visit our offices at GCTC Complex, former Othaya Teachers College, or call us on 0742 606 195 or 0721 706 504 or 0768 411 708. You can also send us an email via sales@gtntv.co.ke. GTN TV, the home of gifts and talents.
Welcome back and thank you so much for staying tuned. Today, we had started on in our earlier segment, we are talking about mental health. We are done with depression, we are done with anxiety if you're just joining us. Now let's talk about bipolar disorders. What are they?
Wow. The bipolar disorder, it's a mental health disorder that affects the mood. You have the mood swings, and you have a lot of, for you to be able, the bipolar is classified into two. We have the bipolar 1 mood disorder and we have bipolar 2 mood disorder. For bipolar mood disorder 1, the patients that maybe you'll encounter, they will have the mania phase followed by the depression. But rarely does it begin followed. But for you to be able to pick it like it's bipolar 1, it will last 7 days. For the 7 days, the patient will present with they are distractible, they are aggressive, they don't sleep, they talk a lot, they have the grandiose, the fright of ideas. So these are the people that you will encounter and they will tell you so many things. And some of the things they will not even be making sense. That is the bipolar 1. For you to pick it, the symptoms have to last for one week, 7 days continuous. And maybe the relatives will tell you the patient has not slept for 1 week. He has been up and down. For the bipolar 2, it have the episodes of the depression. They can have the mania, but the depression dominates. The depression comes now with a depressive mood, whereby the ones that we were saying about, they will have the sad, they will have the lack of interest, maybe they are not eating well, they are suicidal. So that is the bipolar 2. So there is a criteria for you so that you can be able to pick it. For bipolar 1, have to last for 7 days. The other one has the depression part of it. So there is the bipolar 1 and the bipolar 2. Yes.
And we also have another mental health issue, schizophrenia.
Schizophrenia, it's a very broad, because for us to be able to understand schizophrenia, what is schizo? Schizo is a spirit. And phrenia is mind. So schizophrenia is like the spirit of mind. So for the schizophrenia, for you to be able to tell about the schizophrenia, you need to pick the symptoms. And the schizophrenia symptoms, we have the positive symptoms. The positive symptoms have the hallucinations. Hallucinations, we call them the perception. They affect the senses, all the 5 senses. We have the auditory, we have the visual, we have the taste, we have the touch. So it can appear in any. We have the delusion. And for delusion, we say it's a false belief that cannot be changed within with the logical thinking. So if somebody comes to you and they tell you they are God, you cannot change them, because that is what they believe in. We have the disorganized speech. So they will be talking things and you'll not be understanding. They have disorganized behavior. Those are the symptoms now in the positive symptoms of the schizophrenia. For the delusion, for the negative symptoms, we have the arogia. So hawatakuwa na speech. Most of the time they tend to be mute. Evolution, hawana interests. They don't have energy. They don't associate, so there is the social withdrawal. So for the negative symptoms, we call them the 5 A's. So when I say 5 A's, the medics will understand the 5 A's and the 5 and the positive symptoms. Let me say that schizophrenia is one of the conditions that makes someone not perform, like half of your life. Others you can be able to manage very well, but for schizophrenia, it's a bit aggressive. So most of the people that we are seeing in the streets, they are having the schizophrenia.
So these are the people we are calling quote unquote mad.
Wenye watu wamezoea kuita wenda wazimu. Yes. Most of them, they are suffering from the schizophrenia. Yes.
Can it be helped, medically speaking?
Yes, it can. Because if you realize you can manage with the treatment, the antipsychotic, the drugs that we are using. And currently we have the best drugs. We have the 2nd generation drugs with the less side effects. So if these people can have a follow-up and have support, we say the diagnosis and the outcome. You have to do initiation mapema ya dawa. You have to know this is a schizophrenia. Have the family support, identify what was the trigger for this person to develop. And I will give an example. Most of the time you'll end up seeing people who are in campus and they dropped out of school. The people that we call genius, most of them, they tend to suffer from the schizophrenia. Yes.
How is that so?
It's not something that I can be able to explain, but with the research and the statistics that we have, the genius people, most of them, they tend to suffer from the schizophrenia. But there are those people who will suffer from the schizophrenia. Let's say 1/3 of them, they will recover. 1/3 of them, they will manage with the treatment. And the 1/3, those are the people who deteriorate.
You mentioned triggers. What are some of these triggers? What would trigger this?
Some of the triggers, for instance, the pressure that you are encountering. Is it job related, education related, the society pressure, or are you under any treatment, substance use? So this can be either genetically you're predisposed to schizophrenia, but you end up having a trigger, something that will trigger, and you suffer from this condition. The young men that we are finding, most of them substance use. Yes.
So it is true that substance could lead to this, because out there you will hear people say, "Kuyu alikunywa bangi," and now they became like this. So it can actually trigger.
There is the substance use psychosis. So the substance can lead you to develop now the mental illness. Yes.
Okay, in another episode we'll delve deeper into that. So now let's talk about ADHD.
ADHD. It's a neurodevelopmental mental health disorder, and it is picked early enough at a tender age. At the age of 5, you can be able to tell the child is suffering from ADHD. For you to be able to tell the child, let me first tell you what is ADHD. Is attention deficit hyperactivity disorder. Maybe you have ever seen these kids. They don't stay still. They are jumpy. They make decisions. They don't follow instructions. They tend to forget very easily. They are all over. And most of the time you'll hear, huyo wachana naye ni mamake. But maybe this kid is suffering from the ADHD. So for ADHD, they tend to forget. They are hyperactive. They cannot relate well with their peers. At the age of 5, they cannot be able to relate. So the things that these kids of 5 years they are doing, for them they cannot sit down and concentrate. Yes.
But this can be treated?
Yes,
early?
it can be treated. Yes.
If noticed early enough?
Yes. So you only need to put this child into treatment, and the treatment that we give, we call them the psychostimulants. One of them, an example is Litali, and they are being prescribed. The next thing that you can do is the family support, because the family needs to understand this kid, because most of the time they will say that the child is misbehaving, but they have not understood the child. And also now the classroom modalities. If this child is in school, the teacher need to be involved, so that at least they can be able to support the child. So if you can be able to do now the management of the 3, at least the child will negotiate in the mainstream of the society.
This is only affecting kids?
It is starting the childhood as you progress now.
Oh, yes. And then there is the obsessive compulsive disorder, OCD. Obsessive compulsive disorder.
For us to start with what is OCD? Obsessive, it is an intrusive thought. So these are the thoughts that will come into your mind, unwanted. The compulsive is the behavior that you do. It will become a disorder if it is repeated. I'll give an example whereby you are cooking, you are in the house, and you go to sleep, and when you are sleeping, there is a thought that comes to you that you have not closed your door. That is one thought. So you wake up and go check the door. You go back, you sleep. You have made sure that the door is closed. The thought will come again. You will wake up and go and check again. So this is what we are calling now the obsessive compulsive disorder. That intrusive thoughts that comes into your mind and the compassion part of it, it will become a disorder. There is also, in the OCD, you will get the people who are perfectionists. Perfectionists, if I place my book here, you come and remove it, I'll come and make sure that my book is there. So they are orderly and perfect. So OCD has a lot because we have also the holding disorder. And especially this happens with the ladies. We have a dress that we don't wear, but we are still holding it.
Yeah.
So it means that even as, wherever we are having a disorder, kind of. You cannot give it away and you're not using it. So it has been in your wardrobe for the last 10 years. Doing what? Of which you could have blessed somebody with it.
You're obsessed with the dress.
You are obsessive with dress.
think this one is going to be nice for the ladies.
Yes.
I don't know, is there something else to eat? Is it normal? Okay, I hear people saying, I'm obsessed with the idea of this and this, and mostly it's a positive thing, something they want to do. Let's say, maybe we could say, we are obsessed with this show. I just have to watch this show every other time. Hata kama niko nje, I'll rush, I'll make sure by the time the show starts, I want to be there. So is it really that dangerous, or there is a part of it that we can say it's normal?
If it doesn't interfere with your normal functioning, it's okay. But the moment it starts interfering with your normal functioning, it's not. Yes.
Right, and then psychosis. What is psychosis?
Now the psychosis part of it, because when you say the psychosis, we have talked about so many conditions. But the psychosis parts, we can say these are the symptoms. It's combination of everything. And the combination of everything, maybe the person will have hallucinations, they will have the delusions, they will have the sleeping disorder, they will behave in a very funny way. So we cannot pinpoint this is psychosis, because psychosis encompasses a lot, a lot. Yes.
Like you could have all these disorders we are talking in one person.
Yes.
Right. So how are these disorders perceived in our country? Like let's talk about like schizophrenia, for instance. People will look at someone we sick out there and say, alirogwa, and such things. How are we perceiving these mental disorders in our country?
I would say they are made. Because there are some community, they don't believe in the mental illnesses. And these are the people who will come with the witchcraft, alilogwa. There is the stigma that comes in with the mental illness. There is the discrimination part of it. If they realize that you have a condition, they cannot employ you. But they will tell you, umeanguka interview. But because they know that you are suffering from this. So there is a lot. The cultural beliefs, they are making people not progress and get to where we are supposed to be. But I just want to say this, and I will keep on repeating on this. During COVID, people realized all of us were candidates. There was a lot of suicide that came in. There was a lot of complaint. And we thank God, anything that comes, we learn. And the government appreciated that we need help. And there was cry for help. People required to be cancelled. People required people that they can work with them, just to support them. So things are changing, but slowly. But I will say between 2020 and 2023, at least things are changing for the better. Yeah, for the better. And we appreciate. And we hope in the next 5 years, this country will be a benchmark of other countries that will be coming. Because people are appreciating the work that is being done. Yes.
That is really awesome. And for the youth, there is a lot of association with social media. I have to, and then repeat, I'm tired it out. So, for the youth, there is this correlation to do with social media and mental health. Like for instance, some time back we had a youth who murdered their entire family, and then they said they watched a certain movie and it inspired them, or it led them to do that. Is social media affecting our mental health, especially for the youth and those people who are consuming a lot of social media content?
Yes, it is. And I will say this with no fear or contradiction. Why am I saying things? Most of the things that our youth are watching in the TV, or even in the movies, they are trying to copy. And you'll hear people saying, I want to do like whatever I saw. It's very sad, and I will say this because I'm a parent. It is very sad. We tend to copy what other people are doing, and we think that is the lifestyle that we are supposed to live. Why am I saying about the social media? Because we have to live with it. But how do we get now to separate and tell people we don't need to copy what other people are doing? One of the issue, apart from the movies, and there was the example that you have given, and it was very sad because that son belonged to a nurse. But the mother could not be able to pick the symptoms. And maybe the son had some of the signs. And because of the stigma and the notion that comes with the mental illness, the stigma part is part of it, and the discrimination. You tend to associate everything with the drug. And maybe this boy was sick, but there is no one in that family who was able to pick it. Let's be observant of what our kids are watching. Let's talk about these issues that they are undergoing. Because of there is the peer pressure, the society pressure, there is the high expectation they have with you. So if they expect you to be graduating and you don't graduate, you will end up having a lot of issues. So the social media is portraying a picture of perfection. We are supposed to be driving at this age, we are supposed to be owning a car, we are supposed to be dressing like this. So if you don't accomplish that, what is going to happen to you?
You feel like you're losing it.
Yes, you are losing it. You are a loser. Will you be appreciated in your community? No, because you have not been able to achieve what they expected you to do. So we are doing a lot of pressure to these people. So what's our end and our potential?
Yeah,
yes.
And then there is this common saying that no one is posting their failures, so we shouldn't be really copying these trends. Now we've talked about the youth sana. At the other age groups also at risk of these mental health issues, are they going through mental health issues?
Yes. And I will mention like the clinical depression. It's cutting across all the generation, all the age. From the kids who are in the primary schools, there is the high school, there is university, and now the advanced age. So depression cut across all the generation and the age. ADHD, we said about the age, it starts at early. For the anxiety, it starts even early. A child can be scared of maybe a spider crawling. Na itakuwa shida mpaka akuwe mtu mzima. So these conditions, they are cutting across all the age. But the onset, they inakuwa tofauti. Like for schizophrenia, it starts for males, it starts at age of 15 to 25. You can tell somebody is suffering from, depending on the criteria that you are using. For the ladies, itakuwaga grade kidogo. It starts at age of 25 to around 30. But for the females, they have a peak. From the age after now, the menopause, they have another peak. 55 heading to 70. Yes. So the age, it varies with the condition, but some of them that you can be able to pick very early. Yes.
And can mental health affect someone's physical health? And also, sometimes some of the physical health issues we are suffering from, like maybe someone is living with cancer, living with HIV and AIDS, can they also prompt mental health issues?
Yes, it can. And I would start with mental disorder affecting the physical health. If you tend to worry so much, you have ever had people who are so stressed, most of the time they say they are so stressed and they develop maybe the ulcers, the peptic ulcers. There is a hormone that is released. There is the immune. If you tend to worry so much, you tend to lower your immunity. Your immunity tends to go down. So there is the lifestyle factor. The lifestyle factors, maybe you are not feeding well, so you'll end up losing weight because you have a mental disorder. The physical health, for instance, all the other now, the comorbidities, we call them the comorbidities. If you are diagnosed with a chronic illness like cancer, and you know how expensive and the treatment and the process that you'll undergo, most of them, they tend to develop now another mental they can develop a mental disorder, and especially depression. Because these are the people who will feel like they have given all in their life, but they have lost it. So they don't have hope, they are hopeless, they feel guilty. Maybe they will say there's something that I did for HIV, maybe there is something that I did. And you'll carry this guilt with you. So the comorbidities will affect the other side. So you might end up having to use the drugs of maybe hypertension and cancer, and you end up using the other drugs of the mental disorders. Yes.
Oh, that is interesting. And so before we wrap up this segment, there is this thing we call trauma. Like someone will walk in a certain environment, they get anxious, and then they say, I'm traumatized. What is trauma?
The trauma is a stressful event. For instance, you might witness it, or being told somebody share a story that is so traumatic, or apart from witnessing somebody sharing the story, or you read about it. For instance, if you read something like a family that was killed, all of them, they were killed, you feel like you're traumatized. So there are people who will tell you, at a sight of blood, they get traumatized. They don't want to see anything like any blood. An experience. Post-election violence, you witnessed, you are there. So those traumatic events that you witnessed, they will cause emotions to you that can last even longer. Yes. So the trauma, it's those stressful events that you'll witness, you'll hear about them, or you read about them.
And they can trigger.
They can trigger, yes. Yes.
Okay, so we wrap our second segment. See you in the next segment. Stay tuned.
Andika maũndũ tasikiza tuni ya thimũ yaku hihinya *837*321# na igwatĩre rwĩmbo rũrũ ta rũgambi rwa thimũ yaku.
Thank you so much for staying tuned. Welcome back. Now you're going to be talking about why are we perceiving mental health issues like they're not really a disease. Why do we want to feel like they are witchcraft? Has enough sensitization been done? Welcome back and stay tuned. Thank you. So these mental health issues, they're not getting a lot of attention. I want to believe the reason that you'll go to your parents as a youth and tell them that maybe you're going through depression and they don't know how to handle you is because a lot of awareness is not being done. What would you say? Are we doing enough to sensitize people that there are these issues and there are illnesses like any other illness? Like the way I say, I have a headache and I get some attention. Yeah, so...
Let me say that we are not getting, it's a no. There is the stigma part of it. There is lack of awareness that comes along. There is the discrimination part of it. If you tell me that you're sick, you're suffering from mental illness, in my family, what watanichukulia aje? There is the cultural beliefs. Others will believe that you have been witchcraft, maybe they are the things that you did. And others will associate with the behaviors. Maybe they will say that you're using the substance and that's why you're suffering from whatever you're suffering from. The generation that we are having right now, they're having issues in communication. they are not able to articulate what they are undergoing. Either they fear their parents, or they don't want to reveal what they are doing. But I will say, if you realize that you have an issue, even if you're not going to talk with your parents, there is always somebody that you can talk to. You have a friend, you have a relative that you can confine into. You have, if you work in any government institution or any private institution and you tell them that you need help, you need to seek help from someone. But don't stay with your issues. Because maybe these are, for instance, I will say about the trauma. Maybe there is something that you witnessed but you are not able to share it with someone else. So at night you cannot even sleep. So let's be a society and people who can be able to share what is in our mind and what is affecting our day-to-day life. Yes.
And this explains why mental health is not being given enough priority here in Kenya and Africa at large. It's because of the stigma associated with it.
The stigma part of it, there is, let me say, also the funds, the limited funds, the workforce, how many people are there who can be able to diagnose and pick a mental illness. So we have a shortage, workforce shortage, and now the cultural beliefs and the other thing, the stigma and the discrimination part of it. Yes, and there's also the intergeneration gap, whereby you cannot be able to confront your parent and tell them what you have, you are undergoing. Yes.
And sometimes these parents are also going through the same and they don't know who to tell.
If only we can create a family where we can be able to be sharing our issues, that will be a healthy family. Yes.
So let's embrace that. So do we have a chance at preventing mental health illnesses?
Yes, we do. Because we have the primary prevention even before it happens. The primary prevention, you need to do now the sensitization, creating awareness, telling people about the consequences of using the drugs and the substance. If there are these parents who are conceiving and maybe they are using the drugs, we are supposed to enlighten them that they need to stop. Because even if it's not going to affect them, it's going to affect their children. And that is the primary, even before things happen. We have now the secondary prevention part of it. The secondary prevention part of it, we are able to screen early. And if you realize people are suffering, you initiate them on treatment and you do the follow-up. That is on the tertiary prevention. The follow-up, and incorporate them in the society, let them know that they are appreciated, let them being given duties in the society, and they will appreciate, boost their self-esteem. Yes.
Now, as we are talking about prevention, sometimes the cause and the prevention, they kind of seem to clash because, let's say for instance, whatever is causing you to be depressed is your work environment, but maybe it's home. And that is still your family, that is your home. And the home condition or how you live with your family is what's prompting you to get depressed. How can we prevent it? How do we maneuver in such scenarios? Because maybe quitting your job might be a lot. You can't quit your family. They'll be your family.
Yes,
so
they will always
how
be
do
your
we
family.
handle this?
Let me start by saying that the causes of mental illness is multifactorial. It's not one cause. So we have the genetical part of it, whereby you are predisposed because maybe one member of your family is suffering from the mental illness, so you carry the genes and you can end up having the mental illness. We have now the biochemical, and that is the biochemical in our brains. Every condition that we have, or the disorders that we have, it's caused by one of the chemicals in our brain. And I will give an example of a schizophrenia. Schizophrenia is when the dopamine hormone, it makes you feel, you enjoy pleasure. So when it is at the equilibrium, you can be able to enjoy your life. But ikienda juu, you'll end up having the schizophrenia. For the depression, it's there is a hormone that is responsible for it, serotonin. it's a feel-good hormone. A feel-good hormone, you wake up and you're smiling and you're doing your things. But when it goes down, you tend to be depressed. Yes. Something like, what do we call it? The anxiety. It's affected by the GABA. So when it goes down up, not the GABA, it's adrenaline. Let me use the word that people know. Yeah. And the adrenaline, we know, it is responsible for fight or fright. Yeah. So when you have these, ikienda juu, either uchape mtu, ama you run away. So all these, that's what we are calling the biochemical. So every condition is caused by one of these hormones. So there is the environmental. Now I'm going to where you're asking. The environmental, maybe the conditions that you're living in, they're very hostile. And at your work, you cannot quit. But there is something that can be done. You can talk about it. Maybe your boss will not listen to you. But you have the psychologists. Maybe the company have the psychologists. You have the counselors in your workplace. Why don't you talk about the issues that you are undergoing and see whether the management can be changed? Yes. Because if you can't change, or if you can't defeat them in a very positive way, just tell them the things that are making you get stressed. Because if you can be able to highlight them, yes, they might listen to you and change. But there will always be a resistance part of it. For the family, it's a day-to-day quarrels. So I believe in where communication is the key, and people can be able to articulate and talk about the issues that they are undergoing. Yes.
That is very informative, very insightful, and very helpful. We really appreciate you taking time to enlighten us on all of this. That is how we are going to be wrapping it up. But before we do, maybe we want to shout out to someone, want to wish someone Merry Christmas. It's the season. Yes. Yeah, maybe we'll not get an opportunity to wish them again on TV. This is the opportunity.
All right.
Yeah.
So I will say hi to my mom, my daughter, my family yangu ni kubwa. My friends, wherever they are, over and above, my classmates. Yes. So this is an opportunity for me, early enough. It's festive season, holiday imeanza. I want to wish you a Merry Christmas and a Happy New Year, full of God blessings. Let's talk about mental health. Let's talk about mental health. Just to wrap it up, Mumbi, and this is a secret. When you wake up in the morning, learn to smile. Because the moment you smile, in our facial muscles, we have 46 of them. So when you smile, you use less. But when you frown, you end up using all of them. So you grow old. So learn to smile, keep up the smile, you use less muscles, and you live healthy. Talk about the issues that you're undergoing, and always appreciate yourself. We say self-care. Take care of yourself. If you feel like unataka kujivijari, just go have fun. If you feel there is something that is burning you up, talk about it. Live a healthy life. Tusikue watu wa kubeba vitu. Ati umekasirika kutoka asubuhi mpaka jioni, unaenda kulala na umekasirika. Bana. Be happy. Hiyo nimekata.
Nice one. So yeah, let's smile. Let's embrace smile. It's going to help a lot. And yeah, let's communicate. And that's a good starting point to deal with all of this. I want to appreciate you for taking time to learn all of this together with me here and psychiatrist Christine. And see you in our next segment. As we always say, remember that your health is your wealth.
waingirira ku
ngoke yako ikia huko nani kwa my sister
mukanuta njira ule wendo ume uthinde na wira muingi muno ni
giki uragurire ku
we ni guthaka urathaka
ite icio harutire ku cia migio na njeki
atiriri giti giki ni